Hello, I'm Catherine. I'm one of the doctors at the lipid clinic or the cholesterol clinic in the South Eastern Trust. And I'm going to talk a little bit about what cholesterol is and why it matters. So we all have cholesterol in our bodies and we can measure it in the laboratory, or you may have it measured whenever you've perhaps been at an event run by Chest, Heart and Stroke, where they measure it in a little portable device. What is cholesterol? Cholesterol is a waxy or oily substance which is present in the blood. Some of it comes from the diet, from the foods that we eat, and particularly from fatty foods, and some of it is made by the body, so some of it is produced from the liver. So there are two sources from which we get cholesterol. Not all of it is just down to what we eat. Because our liver makes cholesterol, it's impossible to estimate or judge what somebody's cholesterol is by just looking at the things that they eat. There are two factors involved. So because our body makes some cholesterol, there must be a reason that it's there, and there are a few reasons why we have cholesterol present. The biggest one is cholesterol forms a large part of the outer layer or membrane of cells. So all the cells in our body have a layer on the outside of them which consists of lipid and protein, and a large part of that lipid is cholesterol. So a lot of the cholesterol that's present is used to make our cell membranes. The other reason that we have cholesterol is to make hormones. So hormones such as cortisol, testosterone, estrogen, they all start off from cholesterol. So we need some cholesterol to make those as well. Cholesterol is also used to synthesize vitamin D, which is important for healthy bones. So we know that we need cholesterol for some reasons. So why does it matter if there's too much, and why do we measure it? Well, the important reason that we measure is that cholesterol is a risk factor for circulation problems. If we have too much cholesterol, it can be laid down in the walls of blood vessels, particularly in the arteries. It forms little bumps or plaques on those, and that narrows the artery. If it narrows it too much, or we get a clot on top of some of those bumps, then that restricts the blood flow. That's particularly important if it happens in the blood vessels to your heart, or perhaps to the blood vessels in the brain where it might cause a stroke, or in the blood vessels in your legs where it can cause a thing called peripheral vascular disease. So the reason that we're concerned about cholesterol levels is if they're very high, that's a risk factor or makes you more likely to develop circulation problems. What causes high cholesterol? So what are the reasons that people get high cholesterol levels that put them at risk of circulation problems? And there are really two reasons for this. One is the things that they eat and the things that they do, and the other is family history or genetic or hereditary factors. It's thought that probably about 80% of cholesterol levels are affected by genetic factors, so by things that you inherit from both sides of the family, and that's really out of your control. About 20% of your cholesterol level is affected by the things that you eat. So if you eat a lot of sweet food, a lot of fatty food, perhaps take a lot of alcohol, or don't take any exercise, that might increase your cholesterol level. However, because cholesterol levels are affected by genetic factors, as well as by the things that we eat, we can't reduce cholesterol down to normal levels or low levels only by diet. Often medication is required. So there is some good news. There are lots of things that can be done about cholesterol. You can find lots of information on the Chest, Heart and Stroke website about it. It can also be useful to get your cholesterol measured. This is particularly important if there's a strong family history of heart disease, and if that occurs in people in your family who are less than 50 years of age, then you should definitely get your cholesterol level measured. You want to get it measured because there's lots of things that can be done to reduce it, and you'll see also on the Chest, Heart and Stroke website lots of useful information about diet, about managing your blood pressure, and about stopping smoking. All these things reduce your risk of developing heart disease. So be proactive, get your cholesterol measured, and do something about it.